The oral route is a common site for measuring the body's temperature. Placing the thermometer on either side of the frenulum linguae provides the most accurate reading. The temperature of the body varies depending upon where it is taken. We assume a temperature has been taken orally unless otherwise noted in the patient's chart. Patients must be able to hold the thermometer in their mouths and keep their mouths closed during the procedure. Select a different method to take the temperature for those who can't do this. Sanitize your hands before beginning. Assemble your equipment. Remove the thermometer from its storage base. The electronic thermometer is portable and battery operated. If the oral probe is not already attached, connect it to the thermometer. The oral probe is usually blue. Attach it by inserting the latching plug into the plug receptacle on the thermometer until it clicks into place. There is a round opening to insert the probe into the thermometer. Find this opening and insert the probe into it. Make sure you have disposable probe covers. If the box is empty, replace it with a new one. Greet the patient and introduce yourself. Identify the patient and explain the procedure. Ask the patient if she has been smoking or drinking hot or cold liquids. These substances change the temperature of the mouth and cause an inaccurate temperature reading. If the answer is yes, wait 15 to 30 minutes before taking the oral temperature. Grasp the probe by the collar and remove it from the thermometer. This turns on the thermometer. Slide the probe into a plastic disposable probe cover until it locks into place. Never take a temperature without the probe cover. The cover prevents the transmission of microorganisms from one patient to another. Insert the probe under the patient's tongue in the pocket on either side of the frenulum linguae. Ask the patient to close her mouth. This keeps out cooler air that might influence the reading. Hold the probe in the patient's mouth until you hear a tone that indicates the reading is done. You will see the reading on the digital display screen in degrees Fahrenheit. Gajen's oral temperature is 97.3 degrees Fahrenheit. Make a mental note of this reading. Remove the probe from the patient's mouth. Saliva is not considered medical waste. You may dispose of the used probe cover in a regular waste container. But don't touch the used cover. Saliva still has microorganisms that can contaminate your hands. Discard the probe cover by firmly pressing the ejection button while holding the probe over the waste container. Return the probe to its stored position in the thermometer. This automatically shuts off the thermometer. Return the thermometer to its storage base. Chart the results. Include the date, time, and temperature reading. The normal oral body temperature range is 97 to 99 degrees Fahrenheit, with an average temperature being 98.6 degrees Fahrenheit. Proper recording of data assists the physician in making the correct diagnosis and provides a reference for the future.